How often do you go to your medicine drawer or you go into your fridge and you look at the bottles of cough syrup or pectrolite or some form of medication? And then what do you do with medication that's been expired? Do you pour the expired stuff down the drain or dump it in the bin? Please don't do that, because there was a 2020 research paper that found that the disposal of pharmaceuticals by garbage and sewer is still the most common method in many countries, but we have already seen plenty of evidence of micro trace elements of all forms of pharmaceuticals in our wastewater that then runs and flows into our oceans and then found in our marine life. Professor Renier Coetzee is the Vice President of the Pharmaceutical Society of South Africa. Renier, really appreciate your time. Firstly, let's start with what are we detecting in our wastewater and also in our marine ecology?
Yes, morning Lester and morning to the listeners. So it's really a big problem that we see currently in South Africa. So some colleagues here at the University of the Western Cape have done some research on, what do we found in sea kelp at the bottom of the ocean and even 50 kilometers away from the coast in some fish. And so we found some anti-inflammatories, so pain medicines. We found HIV medicines. We found antibiotics in small amounts in the fish, in the sea kelp, sea orchids, starfish. So it's really a big concern. And as you know, it's not normal for medicines to be in sea animals. So it is a big problem.
And even trace elements would be a problem for marine ecology.
Yes. So what we know is when those antibiotics, for example, go into our rivers, even our farmers often use that water to feed their cattle, their chicken, and they go to the slaughterhouses, and eventually small amounts of that can enter a human body. And every time that someone is exposed to an antibiotic, you have the possibility of develop resistance to antibiotics that might be needed in future when you go for a big surgery or you have a lower respiratory tract infection.
So this is obviously because people are discarding the medicines in the garbage. They are throwing it down the drain, dumping it into the toilet. What should be done? Firstly, let's start with maybe medicines in pill or capsule form, maybe your expired paracetamol tablets. What happens? How do you discard of them?
Yeah, so for me, there's two things here. The first thing is we are seeing more and more people buying over-the-counter medicine. So you go to a pharmacy, you buy something where you don't need a prescription, and those sales are increasing. So we really need to be careful when we just go to a pharmacy and just buy medicine. And we're working also very closely with prescribers, so our nurses and our doctors, to have sustainable prescribing. Only prescribe medicine when it is necessary. 50% of antibiotic prescriptions in South Africa is unnecessary. That we have proven. So the one thing is sustainable prescribing, because that will reduce the amount of unused medicines in our cupboards. Now, if you have that medicine, you have that antibiotic in your fridge, your child didn't use everything, or you have those pain tablets that you didn't use, you used the example of pectrolite, now it expired. What do you need to do? First, don't throw it down the drain. Don't throw it in a sink or a toilet. In our rural communities, we see it being thrown into the rivers. The ideal in South Africa, and we've got laws, we've got excellent regulations in terms of what happens with those medicines. Take it back to your nearest clinic or your nearest pharmacy.
I'm gonna challenge you there, Renier, because a message comes through from Helen. My pharmacy wanted several R100 to dispose of my old meds and would only take meds they had dispensed. Not blaming my lovely trusted pharmacy, but this should be free. It should be a subsidized service. Do pharmacies charge?
Exactly. And that's the work that we're currently doing, is to really understand what happens in the communities, because pharmacies should take medicines back, irrespective of where it was sold. But now you need to understand this. It comes at a cost then for that pharmacy, because they have to contract a company that will collect that medicine and take it for incineration, because you cannot dispose it off on landfills. It has to be burned in a specific way, and you can't throw all medicines together and just burn it, because you can think about all the alcohol in the syrups and what that will that can cause. So in the government sector, it's more regulated because they've got budget for that. But our small community pharmacies, they don't budget for take-back programs. And so we really want to also now start working with pharmaceutical companies, because we say that they are responsible for the life cycle of medicine. So it's from the raw materials right through production, right to the end of discarding it. And we need programs that can really help community pharmacies and ultimately our communities, so that we can get rid of these medicines in a manner that is safe for the community and for the environment.
So talk to me a little bit about our dependence on over-the-counter. And I would admit that there are plenty of boxes of Genpain in our medicine drawer, because forgetting that I have, and then I'll stop at the pharmacy and ask, could I have some Genpain? I have a headache, I have a muscular issue, I generally live with a sore knee occasionally. So I have plenty of boxes of Genpain. Talk to me about our over-reliance, particularly of over-the-counter pain medication.
Yes, so South Africa, in the US, we know that there's what they call the opioid crisis. So it's freely available. It's wherever you go, every corner, you'll find it. Now, in South Africa, we're seeing an increase in our opioid use. So that's the type of medicines where there's codeine and other stuff. So it is becoming a huge problem. And like you say, we as the patients, as the clients, every time you have a problem, you go to the pharmacy and they give you something new. And there's no system in place where I can easily track what have pharmacy X sold you, what have pharmacy Y sold you. There's no integrated system. And so the Medicines Council, which is called SAHPRA in South Africa, is really working on a program that they call the Codeine Care Program. So it's only for codeine-containing products, where pharmacies can then register patients and they can trace patients to see where are they buying all of these items in a way to protect that patient, to inform them that, but you've received something similar a week ago. I cannot sell this to you again. So it's really because there's no integrated system of seeing what did you buy last week or a month ago. Because often our older people, they go to a pharmacy, they collect something, and the next week they don't feel better. They go back and they get something else. But it was actually similar. It's like it was the generic of what they received last week. And that is just growing and growing and growing in South Africa.
Professor Renier Coetzee, I really appreciate your time. Vice President of the Pharmaceutical Society of South Africa.